Mouthpiece ventilation is a kind of ventilation which uses a mouthpiece instead of a mask, and patients may get their breaths either passively from the set backup rate from the machine, or they may trigger the machine and use part or all of the volume they get from the machine. It's usually delivered by an angled plastic mouthpiece, but they may also use a straight, what we call straw. Either way, it works very well. Patients using MPV are mostly neuromuscular patients, including patients with ALS sometimes, but also patients with chest wall diseases. It has been tried even in patients with COPD and acute respiratory failure. So it's a whole array of patients. What's important for all these patients is that they have to be able to generate adequate PK flows with or without help from, let's say, air stacking or mechanical assisted coughing. All these patients in need of MPV will have to use their home ventilation for at least 12 hours per day, despite effective nocturnal ventilation. And they have to be able to grab the mouthpiece, to hold it in their mouth, so their bulbar muscles should be good enough. And they have to seal their lips around the mouthpiece so that no air leaks away, and by that way they can be treated effectively. The only contraindications I can think of are patients who have undergone laryngectomy, or patients who are ventilated invasively by tracheostomy and use a cuffed cannula, because then the air will not come into the lungs, of course. Patients need to be cooperative. They should understand what they are doing. They need to be taught about MPV. And they need, as I said before, to be able to seal their lips around the mouthpiece so that there is no leak of air. They should have enough bulbar muscle force to keep the mouthpiece in, and very important, they should be able to have or to adequate PK flows to generate cough, and they should be able to clear their airways. Usually it's used from the age of 6, so young children may use it after instruction. Yes, if proper patients are selected, if all requirements are fulfilled, and if patients are properly trained, it's very safe to use. It impacts their day-to-day life in a very positive way. For instance, patients who are on the ICU, they may be weaned to non-invasive ventilation with MPV, and instead of going to a nursing home with a cannula, they can return home, which is quite important, I think. Patients may improve their speech, improve eating, improve swallowing, meanwhile decreasing fatigue and dyspnea. With MPV, patients usually don't need any assistance. So they stay or become independent. They don't need a carer anymore. And with the mouthpiece around in a wheelchair, it's very easy to take it, and it's always nearby. They don't have to be afraid that it's far away. In addition, if you use MPV, you don't have the disadvantages of a mask or a cannula. With a mask, people may be claustrophobic, but that, of course, never occurs with a small mouthpiece into your mouth, and you neither have the problems which you have with a cannula. So altogether, in our patients, nearly all patients are very satisfied and glad they choose for it, particularly if they are able to avoid tracheostomy by using MPV. Yes, there's quite some literature, particularly in the last 5 years. 2 articles I could recommend, 2 review articles. One is from Garuti et al., published in the Portuguese Journal of Pulmonology in 2014. And another review article is by Pinto and co-workers, which was published in Chronic Respiratory Disease in 2017. But there is much more to read. Michel Toussaint from Belgium wrote some articles about mouthpiece ventilation, Annalisa Carlucci, but if you type in mouthpiece ventilation, you will find a lot of literature nowadays.